Hey guys, Dr. Jeff Ullery at Whole Body Health. I'm going to chat with you today about ileocecal valve syndrome. It's a big long word. It's talking about a valve that exists between the small intestine and the large intestine. And that valve is controlled by the sympathetic nervous system, otherwise known as the fight or flight nervous system. It can be really problematic for people. It can create a lot of symptoms and discomfort for people, and most people don't even know about it. It's something that I'll look for, especially around times of year that are more stressful. Those are Thanksgiving, Christmas, if somebody's having a big event in their life or big events in their life. We're all dealing with some big events right now. For the last 8 months, we've been dealing with COVID and all of the pieces of that. And so the ileocecal valve is that connecting valve, and it can be triggered by some things that we wouldn't typically think of as unhealthy. First of all, the reason we get triggered around Thanksgiving and Christmas is those are big events. We have family, we have a bigger outlay of funds usually. We are usually eating richer foods or more of foods that if we're not eating, we'll go ahead and, what's the word I'm looking for? Partake of these foods that we might not partake in the rest of the year, or at least the quantity. Mm-hmm. And then, and so what can happen, the thing about the ileocecal valve syndrome, one of the things that you'll hear me say in the office is that it's been known as the great mimic. And so people who are dealing with problems with the ileocecal valve, it's part of the digestive system, so you'd automatically think of digestive issues. Like, so constipation, that if you don't usually deal with constipation, or more loose stools, digestive distress, it could be heartburn or reflux. It could be anything that has to do with the gut. Those are the common symptoms for digestion, but it's frequently associated with significant allergies, significant headaches. It can actually contribute to pain in the back. It can contribute to pain between the shoulders. It can contribute to pain in the gut. A lot of times when people are dealing with ileocecal valve syndrome, we'll have to just make sure and rule out that there's no appendicitis. That's a big one. Also, a lot of women will think that they might have ruptured ovarian cysts or some kind of ovary pain. And so these are things that I'll give you a list there, and down in the comments we'll actually have a link that you can actually download our information page, and it'll give you a list of all the other symptoms that can be associated with that as well. But let me just have you stand up, Jude, and turn towards the camera. And so drop your hands. So the ileocecal valve it sits between the belly button and right down in here in the ASIS, or the what we call the front of that hip bone. And so it's basically 2/3 of the way down. It sits right in here, and so this can give a lot of symptoms. And go ahead and have a seat. And so when we're dealing with ileocecal valve, the foods that tend to irritate the ileocecal valve in combination with stress tend to be healthy kind of foods in combination with some foods that are stimulants. So stimulants would be nicotine or tobacco, alcohol, caffeine, thank you, coffee, or Red Bull, or Monster drinks like my kids like to partake of sometimes when I'm not looking. And then foods like high fiber foods. So some high fiber foods like raw nuts. Popcorn is a big trigger for people. If you think about those things that get caught in your teeth, they're like little razor blades, so they really irritate that valve. And then in addition to that, chocolate is another one that can be a stimulant. It has some xanthine oxidase is one of the products, one of the ingredients in that, and it actually is a big stimulant. So you'd want to eliminate those foods. Other foods that are actually healthier are raw vegetables, any kind of high fiber diet. Potato chips is another one that I meant to add just a minute ago. And then spicy foods as well. And so what you'll want to do is you'll want to modify that diet. And I tell people that they want to do that for about 5 to 7 days and make that modification. Some people are really frustrated, but it's just making some slight modifications and really paying attention to how effective, how flared up you are. And so one of the things you could do, instead of doing like a big romaine salad, you could maybe flip some field greens in there and have a salad that way. And then you'd want to peel anything that you're eating any raw vegetables like a cucumber, just peel the outside layer off and just remove some of that fiber. In addition, instead of like a raw broccoli or raw cauliflower, you just steam them, and steam them just beyond al dente, and it won't cause as many problems for you. And then last but not least, you want to do that and make those adjustments for those few days. There are some supplements that we'll recommend people use if the dietary modification, lifestyle modification isn't enough. The lifestyle modification includes figuring out ways to reduce your stress, and so there's some videos we've done on using pinky points and diaphragm breathing and different techniques like that. If you want to, again, check the comments below. But ileocecal valve syndrome pops up pretty regularly, especially in stressful times, and so this is something that might really beneficial to you if you're having those issues. And I like to just recommend these videos for my patients when they walk out, just as a reminder. So thanks for joining us, and look forward to talking to you again soon.